It's for all of those people out in the hospital, the doctors and the nurses and the allied health people who waste hours of their day trying to get messages to the right people and responses back from them.
We have liaison nurses that perform high volume communication on a daily basis, and they often need to speak to our interventional radiologists who are in the middle of performing procedures. And our prior practice was that the liaison nurses would repeatedly walk around the department trying to find the doctor when they were not performing a procedure. Those doctors then would try and ring the liaison nurse who's always on the phone and would have challenges getting back to that nurse when they did have an opportunity to respond to their inquiry. We're now using the role-based communicator tool, so the liaison nurse can send a message when they need to with the details of what they need the doctor to respond to from a communication perspective. And now in between procedures, the doctors can check their role-based communicator dashboard and respond to messages when they have time. And therefore, both of those parties have much more streamlined communication and are not running around in an inefficient manner trying to speak to each other each day.
Yeah, great question. So at the point that FiveP came to us with a proposal, Teams had become embedded in Austin Health as the communication channel. So everybody's got a license and most people are using it pretty extensively. So for rapid chat and phone communication or voice communication and meetings and all that sort of thing, Teams is it. That's what everybody's using. So the question really is, why would you not use Teams? Because it is embedded in our organisation as the communication method. And so when FiveP came along, and to their credit, having been embedded with us for a year and a half, they'd understood the problem. They completely understood the problem because they'd lived and breathed the transition through the hospital. So when they came back and said, we think we can solve this problem, would you like to work on this with us, then it was, for me, absolutely the simple and obvious answer. It had to be yes. On the one hand, everybody who looks at it and gets involved is incredibly, overwhelmingly supportive and positive on this. I've never seen an IT project with such immediate buy-in from the people who are involved in it.